Good afternoon, everybody. I'm Libby Spencer, the president of the Hopkins County Regional Chamber of Commerce, and thank you for joining us today for your focus on member benefits. And I'm really grateful to have a wonderful expert with us today. Julie Russell Miller is with us from BluMine Health, and BluMine Health is one of our newer benefits. If you don't know about it, I'm glad you're joining. You're in the right place. Julie is excellent at sharing the great value of BluMine Health. And I'm going to go ahead and turn it over to her. I want to make sure that there's plenty of time to go over the presentation as well as to take questions and answers. If you are on the phone and you're not seeing the presentation, we will be sending this information out to you via email afterwards. But if you're not able to see the chat bar, you can text me your questions. I think most everyone has my cell phone number, but if not, it's area code 404-242-9573. If you have questions during the presentation that you would like me to pose to Julie, I'm happy to do that. So just give me a text and I will absolutely make sure that you get an answer to that question. So without any further ado, I'm going to go ahead and minimize myself and I'm going to turn it over to Julie.
Thank you so much, Libby. I appreciate that. We've had the privilege of serving Madisonville and the surrounding area for almost 2 years now. BluMine has a network of clinics across the state of Kentucky and in southern Indiana with over 11 clinics available now, and you do have access to the network. But of course, the one right here in Madisonville is handiest. We are here to serve you on Center Street. We're serving over we are up to 18 clients now in the Madisonville area and hope to continue to grow and serve. One of the things that we see for employers is the challenge of healthcare costs and being able to provide that benefit to their associates. Not only is the cost expensive, for small businesses, it can be a big part of their coverage and expenses, and we want to make sure that we don't break the bank. Wellness programs that work are also very important, and we know that a lot of employers truly care about their employees and just don't know where to start and need guidance for that. Recruiting quality employees can also be a big factor, and if you offer competitive benefits, then it can help you retain the best workforce whenever you are sourcing those folks. We want to make sure that it's a cultural fit. Not everything should be cookie cutter. And one of the things that BluMine takes great pride in is meeting with the executive leadership for any company or the business owners to talk through what they think is going to be the best fit for their group. Last but not least, access to care is critical. And in smaller rural communities, we find that there just aren't a lot of resources. We've had the good fortune of having a tremendous staff join our clinic here in Madisonville, and we are here to serve you. And in many cases, we can get you in to be seen the same day. We truly see healthcare differently. We know that having a resource that you don't have to have an appointment and you can walk in, whereas other places you may have to wait days to get in and have expensive copays or deductibles that you have to meet. We also want to make sure that we're helping people live a healthier life. And oftentimes they don't know where to start and they need real ideas on that they can use every day to implement for healthier eating, healthier diet, healthier lifestyles, and we can help with that. We also want to make sure that we're helping eliminate those difficult budget choices, looking at, can I afford a copay to get myself or my family members to the doctor and still balance that out with putting food on the table, paying daycare, and other things that may come into play. And then finally, we want to make sure that wellness is fun. You know, we don't want it to be a burden or another chore, but we want to truly offer options that help you incorporate it into your daily life and provide wellness support that makes it fun. A lot of times folks ask, well, what all can I come to a BluMine Care Center for? What services do you provide? If we tried to list everything, we would be here for another 20 slides. But this gives you an idea of the types of things that we serve in our clinics. I always tell folks that whatever you would call a family doctor or a primary care physician or an urgent care center for, we do that. So everything from your annual checkups to biometric screenings, earaches, flu season, obviously that's been a big one this year, or the kiddos, sports physicals, any of those types of things, we take care of that in our care center. We also offer a robust list of wellness activities. Again, I mentioned the annual physicals and biometric screenings, but also folks who may be dealing with high blood pressure, high cholesterol, diabetes. You can come in as often as you like and be seen to have those things checked. Again, our focus is not only on dealing with your illness at the time, but looking at the root cause of that illness and what we can do to support chronic conditions to get you healthier and make sure that you have a balanced life. Telehealth has been a very important piece, especially with COVID and everything that all of us have been through over the last several months. If you can't make it into the clinic, you can also connect with us either via telephone or via video chat. So if you want to connect and can't make it to the clinic, we can still take care of you. And unlike some other companies that are going to outsource that, if you call us, you're going to connect with our nurse practitioner and with our medical staff to make sure that you're seeing a BluMine care clinician. And even when our staff is busy at the clinic, because we have a network of clinics, they are able to move that to one of our other clinic providers, but they still have access to your medical records. So all of our clinics are connected. And if you have been in to see us before and you speak to one of our other nurse practitioners, they can pull up your patient records and make sure that they start with that information on you already. We also have what's called a Helo app that connects to your smartphone or tablet. So you have access, many folks are familiar with MyChart or something like that. BluMine has that too, and it's Helo. So you can also have access to your medical records at any time through that app. And you can also request refills on your medications if you've been in to see us previously, and request an appointment through the application. Everything is secure. By law, we have to make sure that everything is HIPAA protected, and so we do have secure access, so you can, with confidence, know that you can access those records and it is protected. So let's talk about our partnership with the Chamber and what we can do through them. Of course, BluMine was formed to provide primary care access and wellness through our nurse practitioners at our on-site and shared site clinics. But with the Chamber, we have partnered with them to make sure that we can offer this to even smaller companies. It's been a flagship piece of the BluMine services to make sure that we could serve smaller companies, and the Chamber partnership has allowed us to do that. So what are some of the requirements? You do need to be a Chamber member, and if you aren't a member already, I know Libby can help you with that to make sure that you can join the Chamber. The cost is $70 per employee per month, and that includes the spouse and children ages 2 to 26. So this is not $70 per family member, but $70 a month to cover your entire family. There is a minimum of 4 employees per company to join, and it does have to be set up on an ACH payment through the Chamber. Again, Libby can help you get that set up. Oftentimes I'm asked, does this require that I have an insurance program to join? And the answer is no. We know that in catering to some of our smaller companies, that they may not be able to offer health insurance to their members. So it does not require that you have health insurance to participate in this, because BluMine is not insurance. BluMine is a flat fee service resource to you. And that $70 a month gives you unlimited access to the clinic regardless of health insurance. It doesn't disrupt your insurance or do anything to change it. So if you do have a health insurance plan in place, this is a complement to that, and it doesn't do anything to make changes. And finally, you do have access to our entire network of clinics. It's easy to enroll. We have a whole enrollment packet that we can share with you or that you can receive through Libby for the Chamber program. And again, we can also help you join the Chamber if you are not already a member. So I'll open it up to questions and see what specific things I can help answer regarding the Chamber program and services that we have available to you.
And as a reminder, you can use the chat feature, or I can unmute you and you can ask a question. If you're joining by phone, which I think the majority are joining by phone, you can text me. And we did have one question, and this might be a question best for me to answer, Julie, but please chime in. We have had a question does this have to be purchased by the employer, or can the employer set up the program and then charge each employee the $70 per month to participate? And I can say we have companies doing it both ways. Some companies pick it up for their employees. Others have it set up as a payroll deduction. Julie, do you have any thoughts and best practices from other organizations that you've worked with?
Same thing. You answered that perfectly, Libby. If a company wants to make it a payroll deduction option for their employees, the only thing that I would say is we will have one bill that goes to the chamber, and the chamber will have one bill or one ACH draft that occurs. So it is fall to the company to collect those funds from the employees. But other than that, that's a very small administrative task. And yes, you can make it available for your employees to participate and pay on their own.
I have another question, and this might be a question that you can answer or I can answer. Do all employees have to participate? And my assumption is only if you have a minimum of 4, would you be able to qualify for the program. Julie, would you like to comment?
That is correct. So if you have 20 employees, but you see that only half of them want to participate, yes, you can still participate. There is a minimum of 4. So if you found that you had 3 employees that wanted to participate, you still have a bill for 4 of those employees. The reason for that is we will not be open to the general public to make sure that we can always provide an exemplary level of service to you and can guarantee that same or next day's opportunity to get into the clinics. So with us not being open to the general public, we can't offer it on an individual basis, which prompts the minimum of 4 employees.
Great question. We have another. Can you cancel at any time, or are you set for an entire year once you sign up?
You are set for an entire year once you sign up. And with that, I would say that I believe that we implemented this in April or May of last year. So for anyone that joined now, they would be in for a year. Now, once a year, you can cancel. But yes, so you can join throughout the year. Let's say, as an example, you have 20 employees and you have 10 of your members that join right now, and you have others that want to join later on. They can be added in each month. So once a month, you can make changes to that. And if you had an employee that terminated, then once a month, you have an option to take them off. But completely stopping participation is a once a year event.
If an employee resigns, you can just take them off your roll and not have a problem?
That's correct. So once a month, you can make updates to that to remove terminated or employees who have quit and add new employees.
Someone made a great point. They had heard that you can go to any location of BluMine Health. It doesn't necessarily have to be in Madisonville. Is that still accurate? And would you like to speak to the other locations?
Yes, that is accurate. We have 11 locations altogether. Of those, 8 are shared sites. And I know that we serve some customers in Madisonville now that have members that work in other locations. We have a site in Shepherdsville, Brandenburg, Lexington, Richmond, Shelbyville, Louisville, Jeffersonville, Indiana, Madisonville, and then, of course, our other ones, Somerset, Dunville, and E-Town aren't shared sites at this time. But I can send out a map of our locations with this presentation so that you can see all the different places that BluMine is located.
Thank you, Julie. I do have one more question. We have someone that's on the phone, and they are with a company that has 100 or more employees. Is there a price break for companies that have employees of a certain amount? And is there a different process they would need to go through to sign up?
Yes, there is. So that should probably be a separate conversation. There is a price break if you have that many employees. And there are some other services that are available from an occupational standpoint for pre-employment screenings and work injuries that we can also provide for a larger group.
Great. I'm going to make that introduction, the person that's on the phone. I will make an e-introduction a little bit later if that's okay, Julie. That sounds very exciting.
Yes, please.
While we're waiting for some additional questions to come in, I just want to share my personal experience. My husband and I are also members of the chamber. I work for the chamber, but I do enjoy having BluMine Health as that member benefit. This is the one that we find the most value in. The fact that we can go to the doctor. We love Ashley Strader. She is fantastic. She is an asset to this program. She is one that will listen. She answers questions. She takes time. She offers lots of suggestions. This has just been one of those benefits that I was blown away by, and I've just been very, very happy. And when we sent out our satisfaction survey a few months ago, this was one that people came back and if they participated, it was very highly rated. So great job, Julie. I think customer service is something that you all have down. And Ashley Strader and the staff here in Madisonville, I think, are really phenomenal.
Well, thank you so much for that, Libby. And another thing that I would mention, when we first opened the clinic, we had, of course, Ashley and her staff, Stacy and Amy, who also were part of our team. But because we have grown and added additional customers, one of our commitments was that we would add additional staff to make sure that we could always still provide that same level of service. And we have added an additional part-time nurse practitioner as well as med tech. So there is additional staff that was added in the end of last year to make sure that we could continue to provide that level of service. And we will always keep that commitment to make sure that our staff grows along with the population that uses the clinic, to make sure that you never sacrifice that level of service at our clinics.
I think that's fantastic. I have never had to wait to make an appointment. I've always called, made the appointment. I could get right in, and I'm grateful for that. Well, Julie, I am not seeing any additional questions. I did want to say thank you again for joining us. I know you are incredibly busy, but you are always quick to answer questions. And if there are any additional questions that come up, is it okay if I call you or send you those in an email and we can answer those for those that may think of something a little bit later on?
Absolutely. And we can certainly set up virtual follow-up appointments on an individual basis. And I will be in Madisonville on the 26th of this month. So, I'm happy to do anything virtually, and I will be there in person on the 26th. So anything that anyone needs, I am committed to making sure that we provide that to them.
We appreciate you, and this is a great way to spend the first 20 minutes of our lunch hour in learning about BluMine Health. So thank you for your time. I know this is technically after lunch for you since you're in the Eastern time zone.
That's okay.
But we appreciate everything that you do for us, and we will be in touch very, very soon. And if there are no other questions, it doesn't look like there are, I'm going to go ahead and adjourn us. Everyone, Happy New Year. I hope you have a great rest of your day. This is being recorded as well. It'll go up on our YouTube page as well as our social media channels. And for those that are tuning in by phone, I will send the presentation out to you electronically so you can take a look at it. And if you have any questions, let me know. But without any further questions, I'm going to go ahead and say goodbye and thank you.
Thank you very much.